Today we'll be starting our toxicology unit and talking about the 4 ways that we can classify drugs. So let's get to it. Before we get to the 4 ways that we classify drugs, we also have a way of classifying legal and illegal substances. Unrestricted are medicines sold directly to a consumer without a requirement for a prescription from a healthcare professional. Examples of that are aspirin, Tylenol, ibuprofen, pretty much any medicine that you can buy over the counter without having to show ID. Restricted are substances that can be used but may have some restrictions on them, like the age that you can use them. Regulated substances can only be obtained by a prescription. A controlled substance is a drug or chemical that the government regulates for its production, use, and possession. This includes some prescription medications and illicit drugs. So, what is a drug? Like it says here, a drug is a natural or synthetic substance that's used to produce physiological or psychological effects in humans or animals. The nature of the drug experience can be approached from 2 distinctly different aspects of human behavior. Psychological dependence is the conditioned use of a drug caused by underlying emotional needs. Physical dependence is a physiological need for a drug brought about by regular use. And then just to differentiate between illegal or illicit, an illegal drug is a drug that is against the law to have, use, or distribute. An illicit drug is a legal drug, but it's being used inappropriately. Either not the way it's meant to be used or it's being used illegally. Now to our 4 common classifications for drugs of abuse. The first one is narcotics. Narcotics are analgesics. An analgesic is a drug that relieves pain. Narcotics are a class of drugs used to reduce pain by suppressing the central nervous system's ability to relay pain messages to the brain. This is useful for situations where someone's in extreme pain the majority of the time. Narcotics are also extremely addictive. A person can build a tolerance to their normal dose to the point where pain is no longer manageable. They will usually increase their dosage, sometimes resulting in overdose. There's a lot of narcotics that are associated with opium. Morphine is readily extracted from opium. Heroin's a highly addictive, illicit opioid drug produced from morphine, which is a natural substance extracted from the seed pod of certain opium poppy plants. Codeine is present in opium but is usually prepared from morphine. Fentanyl is a synthetic opioid analgesic, similar to morphine, but it's 50 to 100 times more potent. There's also a bunch of synthetic opiates that aren't actually derived from opium, like OxyContin. Its active ingredient is oxycodone. It's not derived from opium or morphine, but it has the same physiological effects on the body as the opium narcotics. OxyContin is prescribed to millions of people per year for treatment of chronic pain. Here's a list of narcotic effects on the body: sleepiness, relaxation, euphoria, nausea and vomiting, constipation, slowed breathing. Symptoms of overdose of narcotics would be difficulty breathing, low blood pressure, like dangerously low, loss of consciousness, coma, death. Our second classification is depressants. Depressants have a calming effect on the central nervous system. They may induce sleep. If the system is relaxed too much, then the function of the system will cease. This is going to include alcohol, barbiturates, anti-anxiety drugs, and just a bunch of other things that could be sniffed, like glue, model cement, gas propellants like Freon. Depressant effects on the body. The first one is to reduce arousal and stimulation. These affect the central nervous system and slow down the message between the brain and the body. They can affect concentration and coordination and slow down a person's ability to respond to unexpected situations. In small doses, they can cause a person to just feel more relaxed and less inhibited. In larger doses, they can reduce the heart rate, cause drowsiness, vomiting, unconsciousness, and death. Our third category is stimulants. These speed up the central nervous system. They are substances that increase energy and alertness, and it typically is followed by a decrease in fatigue and a loss of appetite. These drugs can be highly addictive and can induce depression upon withdrawal. They can cause death by overworking the brain and or the heart. These include amphetamines, sometimes known as uppers or speed, cocaine, crack, methamphetamine. Stimulants stimulate the sympathetic nervous system, and they increase heart rate, blood pressure, and respiration by dilating the bronchioles in the lungs. They can cause a dangerously high body temperature, especially if paired with physical exertion. Overdose can result in irregular heartbeat, heart attack, stroke, seizures, coma, death. Our last category is hallucinogens. Hallucinogenic drugs affect users' perceptions, thinking, self-awareness, and emotions. The intensity of the high varies from person to person and is dependent on many variables, including dose and tolerance. And marijuana is the most controversial drug in this class because we just don't know what its long-term effects really are on health. A little bit about marijuana. It's derived from the cannabis plant. The part of it that is mostly responsible for the hallucinogenic properties is tetrahydrocannabinol, or THC. And the amount of THC varies depending on what part of the plant you're using. Marijuana does not cause a physical dependency, but the risk of harm is high if you are a heavy user and or using it for a long time. Other hallucinogens are PCP. It's often synthesized in clandestine laboratories and is often smoked, ingested, or sniffed. LSD is synthesized from lysergic acid and can cause hallucinations that can last for 12 hours. Other hallucinogens include mescaline, psilocybin, and MDMA or ecstasy. Hallucinogenic drugs can cause hallucinations, obviously, which are sensations and images that seem real but aren't. People may hear, feel, or see things that aren't really there. Some psychedelic drugs can cause people to feel out of control or disconnected from their bodies and environment. Physiological effects include elevated heart rate, increased blood pressure, dilated pupils, and can often induce nausea and vomiting. Symptoms of overdose are loss of muscle control, tachycardia, which is a fast heart rate, coma, convulsions, high blood pressure, muscle rigidity, rapid eye movement, seizure, and a really high pain tolerance, which can be dangerous because people who are on these can get severely injured and not realize it, which can actually sometimes that can be what causes their death because they've got this severe injury that gets infected, but they don't feel the pain, so they don't know they're injured.